here it is shown that start test. As I'm already logged into my account, so I can start my test. But if you are not logged into your account, so first you need to log in and then you can start. Here it would have been shown to you login to start. And if you are not registered before login, you need to register, and once you register your email address, you can then log in into your account and you can start this free mock test. So let's start. After this, you can see that here is the question statement. These are the options. A 70 kg adult has 30% total burn surface area, fluid needed in first 24 hours. So this is based upon the Parkland formula. So the answer is 8400 ml. How we get that this is 8400 ml? So when you click on this, here the explanation appears in front of you in the tutor mode. So the weight is 70 kg, burn is 30%, time frame first 24 hours. We will use the Parkland formula. 4 ml body weight in kg, multiply total burn surface area, and that will give you the amount of fluid in first 24 hours. So you can calculate it. Then the 50% will be given in first 8 hours and the remaining 50% next 16 hours. They are saying in first 24 hours, so 8400 ml is correct over here. The maintenance fluid is required in the pediatrics and can be done by the formula 4 to 1 rule. For first 10 kg, 4 ml per kg per hour, which is equal to 40 ml. Next 10 kg is 20 ml, and then the 50 kg is 50 ml, because 1 ml per kg per hour, and in the next 10 kg 2 ml per kg per hour. So you need to use this rule for the pediatric population. We have taken this as a pediatric patient, and for that reason this is the 70 kg, although it is very rare in pediatric population that a child would be 70 kg, but just for the purpose of understanding, the whole explanation has been given over here. So total maintenance fluid will be 110 ml. In 24 hours it will be 2640 ml. So when you add 8400 ml plus 2640 ml, so this would be 11040 ml. In option there is no 11,040 ml, so likely, and they have also mentioned that this is adult, a 70 kg adult. So even though if 11,040 ml has been given, still the answer would be 8,400 ml, because this is adult. For adult, just 8,400 ml in the first 24 hours if he or she is 70 kg. In feeds, it would be 11,040 ml if the child is 70 kg. So here you can see all the explanation. Then you can also watch for the lecture over here, and that is the Parkland formula has been described over here.
The Parkland formula for burns is the topic.
So this is what it is with this MCQ. Now the next question, they are saying a man presented to emergency department with chest pain, ECG shows ST elevation in lead 2, 3 and AVF, and inferior wall MI was diagnosed, but the pain since its onset is less than 1 hour old. Which of the following enzyme is expected to be raised in this patient currently? So they are saying less than 1 hour, that means the first enzyme that would need to be raised is myoglobin. So we will select the myoglobin, and this is the correct. Now here is the complete explanation, that the golden standard for MI is troponin I, for reinfarction is CKMB, and in first hour the myoglobin will be raised. They are also saying that the most sensitive and specific marker for MI is troponin I, and that is the gold standard. The level rises in 2 to 4 hours after infarction, peak at 24 hours, and returns to normal by 7 to 10 days. Similarly, for the CKMB, they have given the explanations, and for BNP, they have also given the explanations. Now, if you click on this button, so they will show the relevant recalls, that is the relevant recalls of this concept which were tested in the FCPS 1 exam. So here you can see a lot of recalls come in front of you, and you can then practice each of them as well. You can just, this is, let's suppose this is the recall number 1. So this is the whole philosophy, that how all the things are collected together in the Dr. School of Medical Education. So the relevant recalls: a 58-year-old man presents with acute onset center chest pain radiating to the left arm, accompanied by diaphoresis and nausea. ECG shows ST elevation in lead 2, 3 and AVF. What is the most likely diagnosis? So this is there is ST elevation. So they are showing the ST elevation. So this is STEMI. So you can also click. Let's suppose I am clicking on the NSTEMI, which is incorrect answer, and I will just click on the show answer. When I click on, so they will say this is incorrect and this is correct. Then they will give you the explanation of this, and also the high yield exam points as well.